great British institution, the National Health Service, which 8 out of 10 of us believe is so important to this country, it must be maintained at almost any cost. With this key service that we spend billions on every year and which employs 1.3 million people, what are those things that are most important for patients? What are the things that doctors and nurses need to do to give patients the best possible experience and get them well quickest? Because interestingly, there is not that much relationship between how patients feel about their care and official measures such as how much is spent on each patient, or indeed, in fact, the likelihood of the hospital killing them in the first place. The NHS has obviously gone through a period of enormous expansion in terms of spending and staff numbers. Now money is going to be much, much tighter in future, and that's going to mean that it's all the more important to focus in on the things that matter most to patients. Good quality research is an important way of doing that. We need to find the things that don't matter and focus on the things that do. It's not about the amount of money that's spent per patient. It's not necessarily about clinical effectiveness on its own, and it's much more about the overall package of care, how well people feel they're listened to, how they're involved in decisions, the way in which doctors and nurses communicate with people, as well as basic things like cleanliness that matter.